So, ulcerative colitis is a Western medical term. And therefore, I, as a Chinese medicine practitioner, am not allowed to diagnose that. So this is a condition, if somebody comes in with ulcerative colitis, it has to be granted via a Western medicine diagnosis. From a Chinese perspective, we have different differentiations of symptoms associated with large intestine malfunction. The harbingers, the straight simple ones, as you mentioned, are the same. Diarrhea, blood and pus, most likely associated with bowel movements, pain in the bowels, pain in the guts, tenesmus as well. But we define tenesmus more as the inability to feel as though the bowel has been entirely evacuated. Those are the large evaluative criterion. Of course, it's large intestine related. So it'll be pain along palpation of the large intestine, and then also pain along the large intestine channel and pain along the large acupoints of the large intestine channel. That being at the web of the thumb and the index finger and at the crook of the elbow. That's our evaluative criteria to assume that it's a ulcerative colitis. Now, we've got syndrome differentiation, so we look at it a little bit different. In Chinese medicine, we differentiate. If somebody comes to me with painful diarrhea or diarrhea with blood and pus, if I'm expecting that, the first thing I'm going to do is send them to a Western physician to evaluate them if they have ulcerative colitis. Because if they've got, for instance, toxic colitis, hemorrhagic colitis, or bowel perforation, Western medicine is what they need. And that has to be ruled out first and foremost. Now, if they come back with ulcerative colitis, we break it into two different phases. It's either the acute phase when they're in actual flare-up or the non-acute phase. And depending on what phase they're in will dictate how we treat them. If they're in the acute phase, we got to clear the heat and settle the bowels. If they're in the non-acute phase, then we could nurture their constitution to protect them from future flare-ups from occurring. Now, that being said, we've got six main differentiations. And within Chinese medicine, when we look at any condition, the first thing we apply is what's called the 8 principles, which I talked about last time. Is this something from the outside coming in, or is it something from the inside going out? Is this something of an excess nature or deficiency nature? Is this something of a hot condition, a cold condition? Is this in the general classification of yin or yang? And we apply a thing called the principle of 10 questions to ascertain the information we need to assign which 8 principles apply, and then that dictates the differentiation that we'll use in our treatment principles. Once that's all done, the most common differentiation in ulcerative colitis from Chinese medicine is damp heat in the intestine. This is a person that's going to have a hot burning anus. They're going to have a scalloped tongue with a thick yellow coat, even a thick yellow coat that's peeling. And I looked at a lot of tongues from Byron Bay, and I shared that with you. You guys got a lot of damp heat, environmental. Yes. Also dietary. So damp heat can come from living in a damp heat environment in the body, attempting to clear the damp heat out of the environment. From Chinese medicine, we could say that could cause ulcerative colitis. Mm-hmm. That's very interesting that it's not only dietary, but it could be environmental. It could be dietary. Somebody eats spicy, greasy, fried chicken wings. We got this thing called buffalo wings in America. When we fry wings, we cover it with chili sauce. I mean, that type of stuff is damp heat, and that can accumulate in the bowels, irritate the bowel lining, and then create the pathogenesis that creates ulcerative colitis. The other things associated with damp heat in the large intestine, diarrhea with pus and blood. The blood should be bright red in color. Abdominal cramping, tendencies toward fever, headaches along the sides of the head, and thick yellow coat and rapid pulse. So that's the most common etiology from a Chinese medicine perspective of damp heat. The other external cause can be damp cold. A person that has too much damp cold, the cold can congeal the energy of the intestine and irritate it as well. Their symptom presentation would be much different. They would have diarrhea with mucus and watery stools. Rather than bright blood and pus, they'll have mucus and watery stools. They'll have tenesmus more. They'll have that greater sensation of restraining of the bowels that can't be released. They'll also have a general heaviness in the body, and they'll also have a lot more clear urination because the body's trying to clear out the dampness. So that's damp, cold in the spleen. Those are two excess conditions from the exterior. Now we've got two excess interior conditions that can lead to ulcerative colitis. The first of which that I see all the time is liver qi stagnation overacting the spleen stomach. This is somebody who's so pissed off, but they can't speak it and they're swallowing their anger. And for whatever social construct they've been exposed to, they're irritated, but they can't release the irritation and they stomach it, they swallow it. This could, I think about sometimes, could this just be gallbladder? Just liver excess producing bile salts that are just streaming into the guts, burning the guts up. I know that would hit the small intestine more, but that's kind of an example of how liver excess can burn up the guts. These people are going to have emotionally triggered colitis. When they get pissed off, it's going to get worse. They're going to have stronger cramping, and these are the ones that have colitis with chest tightness and difficulty of breathing. So we also, the difficulty breathing etiology, remember asthma, one etiology is liver qi stagnation. So liver qi stagnation could be a comorbidity to ulcerative colitis. They're going to have a plum pit sensation in the throat, globus hystericus, with that liver energy coming up and getting blocked. And these are the ones that are going to have the red eyes, because that liver extension to the eye and that heat coming up. These people, when I work on them, I find body work and getting them to cry and scream and getting that emotional relief has a tremendous effect. We'll talk therapeutics later. The last internal excess etiology within Chinese differentiation is qi and blood stagnation. This could be somebody that's had a blunt trauma to the gut or too many surgeries to the gut, decreasing blood flow to the tissues, and then the tissues not being able to accommodate the feces passing through. If there's not enough blood flow, the tissues are more likely to get damaged. The tissues are more likely to not heal. The tissues are more likely to present ulcerative conditions. So we would say qi and blood stagnation is the fourth excess internal differentiation for ulcerative colitis. These folks are going to have diarrhea with dark blood in their stool. Versus the damp heat's going to have the bright stool, the damp cold is going to have the watery stool. If they have thick blood clots of dark color, they're going to have extra straining to eliminate their bowels, and they're going to have thick stabbing pain, like knife-type pains in the guts. That's a qi and blood stagnation. And their tongue presentation is going to be purple, whereas the damp cold is going to have a pale color to the tongue that's swollen, and the damp heat is going to have a red tongue with a thick yellow coat. So in summary, the four excesses are qi and blood stagnation, liver qi stagnation, damp cold in the spleen, and damp heat in the large intestine. We now have two additional deficiency differentiations for ulcerative colitis. The first of which is straight up spleen deficiency. In Chinese medicine, spleen as an organ is heavily involved with digestion. I know in Western medicine, it's involved primarily with blood processing and blood recirculating and blood recycling. In Chinese medicine, spleen is very important for digestion. And it's shown that in Chinese medicine, there's paired organs: kidney and bladder, liver, gallbladder, lung, large intestine. Spleen and stomach are paired. They're right next to each other. So the blood from digestion gets drawn from the spleen to recruit digestive juices. If the spleen doesn't have enough energy, there won't be enough digestive force, and the food won't get digested very well, and that'll irritate the bowels, causing ulcerative colitis. These people will have undigested food in the stool as a clear diagnostic criterion. They'll have a weak diet. They'll have burping and vomit burping, belching after eating, and they'll have a big puffy tongue.
Big puffy tongue, yep.
Big puffy tongue. The last differentiation is spleen and kidney yang deficiency. This is also a spleen deficiency, but it's not having the digestive heat. Spleen yang, the fire of digestion. There is enough blood in the spleen, there's just not enough fire in the digestion. If somebody has too much ice, too many cold raw vegetables, they just constantly are eating cold things, that'll damage the spleen yang. The spleen won't be able to present the fire it needs to break food up. And eventually the kidney yang will be depleted, because the kidney yang is the source of yang for the whole body. So if the spleen yang goes deficient long enough, the kidney fire will wane. Mm-hmm. We'll know the kidney fire has waned when a person has back pain and knee pain, as well as diarrhea. So not just the diarrhea with undigested food, that's just spleen. But if they have diarrhea with undigested food, with back pain, knee pain, and then they also have impotence, they don't have that kidney fire to draw the erection. If they got difficulty hearing, circles under the eyes, and general fatigue and lassitude, then those are clear diagnostics for spleen and kidney yang deficiency. So those are the 6 differentiations for ulcerative colitis from Chinese medicine perspective, with some associated symptoms for diagnosis.
It's awesome. It's super interesting. So there's the spleen deficiency and the spleen and kidney deficiency. Would they be longer term? You'd expect that they would have had symptoms for an extended period of time, or can that happen reasonably rapidly?
No, it takes a while.
Takes a while. Yeah, cool.
Unless somebody's got a condition that's congenital. They were just born with really weak digestive juices. Then it'll be continuous. These are chronic cases.
Chronic cases,
The deficient ones are chronic cases, and they're the ones that are best treated in the non-inflammatory periods, in between, not when the bowels flared up. I mean, the Qi and blood stagnation from a fixed blunt trauma, that can happen quick. Yep. Liver Qi stagnation, if you get really pissed off and hold it, it can happen in a couple days. Ulcerative colitis flare up. Damp cold in the spleen, you got to eat a whole lot of ice cream to flare it up, but it's possible. It's possible. And damp heat can be very acute. Just have one basket of onion rings with chili powder on it.
Yeah. For that person that's already propensity to that, they're just adding fuel to the fire, and they've got symptoms.
Yes.
Yeah. Hey, what's your, I heard you mention weak diet. What's your definition of a weak diet? Yeah, I think it was the spleen deficiency. I'm not sure, but yeah. What would you call a weak diet?
Well, it's not a weak ability to process food, weak digestion.
Weak digestion. Okay, cool.
A poor diet will contribute to weak digestion.
Yeah.
Yeah, so weak digestion.
Yeah, so it's more the digestion.
Yes. Thank you for that clarification. And that could be congenital from birth, family, as you mentioned, or it could be behavioral. It could be accumulated or accrued.
It's certainly what's interesting is, so from my perspective, we don't have a great causative agent for ulcerative colitis. And just having run through those, it's like, oh, hello, here we go.
You got a bunch.
I got a bunch of causes now. And the second thing is that we also recognize the intermediate periods, the ulcerative colitis with the flare-ups, and then nothing, and then a flare-up, and then nothing. And that's probably on the milder scale of it, but really interesting to hear that you see that as well.
Isn't that interesting that coming and going can be associated to the flux of emotions, the flux of diet, but also the flux of environment? We both live in damp heat communities. I live in Maui, you live in Byron Bay. There are periods of time in the transition between winter and summer where it's both wet and hot. And in that period, there's a greater increase of ulcerative colitis in our community. Just environmental.
Just everything else stays the same.
When it gets really hot, damp, and humid, people can have flare-ups.
So right, yeah, absolutely. It's definitely. I mean, we're definitely hot and damp for big, good chunks of time here, and the same in Maui. I mean, absolutely. All right, I'm stoked by that. That's so interesting, and very. Just to what for me, what questions I can ask to kind of just differentiate within my. I mean, it's still going to be a diagnosis of ulcerative colitis for me, but I'm like, oh, is that blood bright red, or is that blood more kind of more dark? Or little tweaks just to examine further what's going on from a Chinese perspective.
Yeah.
So why don't we move to treatment and therapeutics?
One more thing I forgot to mention. A clear harbinger for spleen and kidney yang deficiency etiology, ulcerative colitis, is daybreak diarrhea. The ones that wake up and have to run the urgent daybreak diarrhea, that's a clear indication of the spleen kidney yang deficiency.
Right, okay. As soon as they wake up, they got to run to the toilet and they got diarrhea.
Daybreak diarrhea, yeah.
That's cool.
Yeah. Treatment.
Let's go to treatment. Yeah. I was tempted there to go ask why, but let's move to treatment. All right. So Western treatment. All right. We have an interesting drug called mesalazine, which is a 5-aminosalicylic acid. And it was previously we used another drug called sulfasalazine, but this new one called mesalazine seems to work much better. Interesting, rectal application works the best, and essentially this has to be given either as a foam or an enema or a gel. And if that's the case, they're quoting a 90% effectiveness. And basically, my understanding of this drug is that it's going in and it's a topical anti-inflammatory. It's turning off the inflammation, turning off a bunch of the inflammatory pathways is what we think is happening, and it seems to work quite well. If it doesn't work, or the patient refuses to use rectal medication, that you can use it orally, but lower success rates, around 70%. And then as it goes in severity, as the ulcerative colitis gets more severe, they start to use both oral and rectal, and then can add in steroids as well. So either topical steroids or, in severe cases, oral steroids as well. So really, this is a model of inflammation. We're trying to suppress the inflammation. Couple of so in mild disease where there's big chunks of time, like more than a year between relapses, they say don't treat at all. If it's more frequent like that, then they're probably going to be using daily medication. Can have anxiety and depression secondary to the actual disease itself, to watch for that. And then did mention the immediate sending of a patient to the Western doctors for ruling out of the severe complications. So as you mentioned, toxic megacolon. So that's where the inflammation starts spreading into the muscle layer. Can be very severe. Massive hemorrhage is a possibility. So the blood just starts pouring out. And perforation. So the bowel pops, and now we've got fecal matter into the abdominal cavity. That is a high rate of death, at least 50%. So we treat that with antibiotics. And all of those three would be looking for colectomy. So they're going to excise the bowel, the bowel, taking out the diseased bowel surgically, and then either reconnecting it and just having a small intestine pouch to act as a rectum, or into a stoma. So basically cutting out the tissue. So that's basically the rundown from my perspective. Mesalazine, pretty good medication, but if it's not mild, then they're on it long term again. So yeah. How about for you? What do you got?
Man, I'm glad you guys can do all those things. From a Chinese medicine perspective, we're really good at the mild and moderate cases. In the severe cases, we're good at treating the acute inflammation, but any associated blood perforation, the megalocolon, those are definitely cases of emergency and hospital care.
Yeah, absolutely.
From a Chinese medicine perspective, our treatment regimen consists of 5 main branches, which we talked about in the last one. The first of which is massage therapy. I found this to be extremely effective in the liver qi stagnation cases I talked about before, because I could free up a person's emotions, get them to scream, yell, or cry, release the emotions, the liver decompresses, the burden on the bowels is released, and the symptoms go away very quickly, 12 to 24 hours.
Wow.
And I have several clients that with ulcerative colitis that know when they get emotional triggers, they'll come in and I'll release them emotionally. And that's fabulous. Massage therapy is also good because we can massage the bowels in a clockwise fashion to help the fecal matter move through the bowel so it's less irritating. Also, by touching it in a gentle, slow way, it increases blood circulation to the tissue. And anywhere there's increased blood flow, there's increased speed of healing. So just the massaging of the organ proper. And then the meridian in and of itself is a fascial band of tissue that goes from the guts down the arm. And by knowing how to stretch and move the arm while counter pulling on the bowels, the tissues of the large intestine can be stretched. And by stretching the tissue, any points of rigidity loosen up. And when it loosens up, once again, the blood flow increases and the tissues can heal more. So just knowing how to stretch a meridian while holding the organ and counterpoint helps massage-wise. That's what I got with the massage on it. The next is acupuncture. We'll actually do needling over what's called the front moves or the front opening points on the intestine, and that increases peristalsis of the large intestine, helps evacuate the bowels, helps increase blood flow and lymph flow to the tissue. And then we've got acupoints that clear heat from the large intestine, such as large intestine 1 at the tip of the index finger, large intestine 4, large intestine 11, even large intestine 20, but especially 1 and 4 and 11 are fabulous for clearing heat from the intestine. Stick a needle on the peripheral meridian in and of itself can pull heat out of the organ. We also have what's called biphasic regulation points, points that regulate the large intestine in case of constipation or diarrhea. Stomach 36, stomach 25. These 2 points are also very effective for ulcerative colitis. They harmonize the bowels. It gets them out of the quiver, achy, contracting state. It gets the large intestine to soften and relax. So symptomatically, it's very relieving. The other branches of Chinese medicine, movement therapy, the lung and large intestine are paired. So exercising the lung helps open the large intestine. Anyone with constipation should know, if they don't know already, taking deep breaths while attempting to have a bowel movement will help the bowel move. Hold your breath while you're trying to have a bowel movement and the bowel will be more restrained. So lung movements, big lung movement, Qi Gong. And then teaching a person how to move their own intestines by massaging it clockwise.
Yep. Squeezing the toothpaste.
Squeezing the toothpaste through the tube will also help, as far as movement therapy. I've saved the best ones for last in ulcerative colitis, being that it's part of the digestive system. Diet goes into the digestive system, so diet therapy is essential in the regulation and control of ulcerative colitis in 2 ways. The first of which is eliminating the stuff that's causing it in the first place. So some people have celiac disease where they're hyperreactive to glutens, wheats, flours, and highly refined sugars. This can also apply to the large intestine. Some people are lactose intolerant. Eliminating the allergens is one really important thing in the remediation of the symptoms of ulcerative colitis. Most people that have this condition are already aware of that. The other dietary concern in relation to ulcerative colitis is malabsorption. People with this condition tend to not be able to eat much or absorb very much. I know the large intestine is not the nutritive absorption organ. It absorbs fluid, but it doesn't necessarily absorb nutrients. That's the small intestine's job.
Yeah.
But nonetheless, ulcerative colitis people do tend towards malnutrition. So diet also has to take into account in the treatment of this disease how to increase nutrition. For that, kanji. I have seen so many people treated and completely reversed ulcerative colitis with an exclusive kanji diet for 30 days.
Whoa.
3 times a day, kanji. Half a cup of rice, 4 cups of water or stock. Start with water first, move up into stock. Chicken stock first, beef stock next, fish stock later. And make a kanji, a heavily cooked rice soup. The beauty of kanji is it's the bridge between diet and herbology, because our Chinese herbs we boil in water. So you can boil the herbs in the kanji to infuse the herbal medicine dietarily. So you put in, if it's a damp heat condition, the formula we use is xiaoyaotang. And you could take a few of the emperor herbs out of that formula, boil it into the kanji, and take that as the medicine. In damp cold conditions, we would boil it with ginger and green onion. With liver qi stagnation, we'd boil it with mint, with citrus peel, with dongui or chai hu. And then in qi and blood stagnation cases, make a kanji with herbs that promote blood movement, such as rhubarb root. Rhubarb root is a harsh cathartic. It creates just purgative diarrhea in short cook in 5 to 10 minutes. But if you cook it for 3 hours, there is no purgative effect. It just clears damp heat and treats blood stagnation.
Wow.
So that's a kanji with just heavily cooked rice. And then to add nutrition to it, add in chicken bone, chicken meat, chicken flesh, and at the end, bring in some egg white. Egg white is one of the least inflammatory dietary proteins available. So these are ways, and then you can always add coconut oil in it. It's beautiful anti-inflammatory coconut oil. Just add a kanji with egg whites and coconut oil. A little bit of salt, just a little bit of salt, just for the electrolytes. And this is a way that the gut gets neutralized of allergens, and nutrition is greatly increased for the client.
Wow.
Yeah. So, and then I told you a few, the herbal. Xiaoyao Tong is for damp heat. And Wei Ling Tong is for damp cold in the spleen. Tong She Yao Feng for liver qi stagnation. And then Juyu Tong, or Xiao Fu Juyu Tong, for qi and blood stagnation is the primary formula. For spleen qi deficiency in ulcerative colitis, the primary formula is Shen Ling Baiju San. That's a beautiful formula. Ren, Shen, Baiju, Fu Ling. These are just basic, Baiju and Fu Ling alone are fabulous herbs for the bowels, just to neutralize and drain damp from the bowels. And then the primary formula for the spleen and kidney yang deficiency, ulcerative colitis, Zhenren Yang Zong Tong. You can look up any of these formulas. Don't take the herbal formulas on your own, folks out there. Go to see a really good herbalist, because these are guidelines. Within Chinese herbalism, there's a base formula for each of these conditions, but everybody's a little different. So there's often co-contaminant differentiation. So liver qi stagnation will tend towards heat, and it'll tend towards spleen qi deficiency. So it's not always just one. A person could have liver qi stagnation with spleen deficiency with retention of damp heat in the bowel, in which case these formulas have to be modified. So,
this is not Google medicine. Don't Google herbology. It's potent stuff, hey?
Now, if you want to do a Google one, there is one herbal formula that's a single herb, and it's called Qing Dai. Qing Dai is Isatis leaf, or indigo leaf, and let me see if I've got a better, Isatis tinctoria. Qing Dai is Da Qing Ye is the main herb. Da Qing Ye, it's a single herb. They take the leaf and they pulverize it and put it into a powder. In the World Journal of Gastroenterology, 2013, volume number 17, did a research study using this single herb. And 6 out of 7 participants in the study, after 4 months, were able to stop all Western medication.
Wow.
Just taking Qing Dai Pian, the single pill. This pill just pulls heat and toxins out of the large intestine, decreasing the inflammation on the bowel orally. And that's Qing Dai Pian. So that's what we got treatment-wise herbally. But once diet and herb, emotional and environmental. Environmental people don't want to hear. You got to move to a cool, dry environment. Sorry, you can't live in damp heat anymore. Oh, you got to give up the spicy, greasy. Well, most people will do that. The environmental one's tough.
Yeah. Leaving these places it would be tough.
Damp heat's kind of nice to live in. It's kind of nice, It's always warm and fuzzy, and everything grows very good. It's nice, but move higher up onto the mountain where it's drier.
That's awesome. That's so cool. So once again, what I'm noticing in Chinese medicine is that other than the single herb that you were talking about, the rest of them are treating the correct syndrome differentiation. So if they have damp heat, then you're releasing the damp releasing the heat and what's the opposite of damp?
Draining damp. There's two ways to deal with damp. There's two ways. You can drain the damp, or you can transform the damp aromatically. So Baiduco, Roduco, patchouli is a very common herb that people are familiar with. These are herbs that aromatically transform damp. Think of shaking up a soda can and releasing it. The damp can be broken back up into a gaseous state and released by transformation. So that's how we deal with damp. So yeah, if it's damp heat, drain the damp, clear the heat. If it's liver qi stagnation, free the liver. If it's damp cold, transform the damp, warm the cold. The digestion likes to be warm. The belly likes to be warm. So if it is a heat condition, cold herbs have to be done delicately and for short periods with breaks in between.
Mm-hmm. Right, so if you just dump in a whole bunch of cold herbs all the time,
you're going to end up with digestion, and you'll end up with spleen qi deficiency. And if you keep going, you'll end up with spleen yang and kidney yang deficiency and complicate the condition further.